And so just want to thank you for coming over to our 1 o'clock session. My name's Angela Allison, and I'll be your facilitator along with McKenna Serpa. As a reminder, this session is being recorded. Please keep your mics muted unless you are asking a question. You could put it in the chat, and we could read those out for you. Or if the presenter asks for response, you may unmute yourself. This is more of an interactive presentation since you can unmute yourself instead of in the webinar where you were forced to be muted and only could ask in the chat. If they do ask for a response, we would love to have your interaction. And so this session is titled Your First Patient, Improving the Health of Your Own Community Through Interprofessional Collaborative Partnerships. This will be a 2-hour session, and like I said, it will be interactive where through the presentation we will break up into breakout sessions into little rooms with small groups so you can talk to each other and complete an activity. And so to introduce who is presenting today, we have Dr. Renee Kinman, and she is currently the Medical Director of Pediatric Endocrinology in the University of California, San Francisco, Fresno Pediatric Medical Education Program. She is an Associate Clinical Professor at University of California, San Francisco, and a member of the UCSF Academy of Medical Educators. She has an extensive experience in curriculum development and education and serves as a member of the Fresno County Youth Health Corp Steering Committee, as well as the Fresno Unified School District's Career Technical Education, Health and Human Services Subcommittee. In her free time, she continues to figure skate, having achieved the rank of a gold medalist through the United States Figure Skating Association. And joining Dr. Kinman, and she has brought 2 students that she's working with from Fresno State. The first is Keyara, a freshman in Smith Camp Family Scholars at Fresno State. She is currently studying biology as a pre-med student. 2 summers ago, she had the opportunity to be a part of the UCSF Summer Biomedical Research Internship Program, where she paired with Dr. Kinman and her partner, Vincent. Through the summer, she worked on creating diabetes and endocrine websites, a YouTube channel, and a few instructional videos to empower patients and improve self-efficacy. Today, she's here to share her experience and the lasting impact her project has had. And also we have Alyssa, is her 4th year at Fresno State, pursuing a biochemistry degree with the intent of becoming a physician in the near future. She has been working with Dr. Kinman for 2 years, addressing social determinants of health through a youth as partner approach. Alyssa hopes to take the lessons she has learned and stories she has heard to serve and uplift the Central Valley. And so I will go ahead and hand it over to you, Dr. Kinman. Thank you.
Hi, everybody. So we basically want to talk to you about the work we've been doing. Are you ready for your first patient? Because the reality is you could actually already be working with your first patient. You don't have to wait till you go to medical school. So what part of the medical field are you interested in? Given that this is a conference for aspiring doctors, we're assuming that for most of you guys it's medicine, but you may be interested in something like dental or pharmacy or something like that. But don't worry, no matter what you want to go into, this workshop will be useful for you. Oh, Alyssa, you have to unmute yourself.
Sorry. So let's start with some basic definitions. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity.
Keyara, you have to, there you go.
Got it. So sorry, my webcam isn't working, by the way, but I'll try my best to fix that. But so there's a strong correlation between your health and your success. And there's like a negative correlation between poverty and health. The more impoverished you are, the harder it is to maintain your health and the harder it'll be to be successful.
So if we look at health equality, sorry, I'm getting little things floating across my screen. If we look at things called health equality and health equity simply means that everybody is treated equally when it comes to healthcare. So as an example, say you take the total population of the United States, you divide it into groups of 5,000, and you build a healthcare center that was available for every one of those 5,000 individuals. Well, each of those individuals could then be seen at that healthcare center totally for free. Don't have to do anything during the hours that the clinic is open. So this would be health equality. But health equity means that everyone has a fair opportunity to live a long and healthy life. So if we look at it here, what if your clinic was only open limited hours? What if you lived 100 miles from the clinic? What's going to happen to that person who works from, say, 8 until 6, and they're going to be fired if they take off? Or somebody who lives 100 miles away and they have actually no transportation to get there. So health equality doesn't necessarily mean health equity.
To put it in another way, equality sounds fair, but equity is fair.
Which leads us to the definition of the social determinants of health. So according to the World Health Organization, the social determinants of health are the conditions in which people are born, grow, live, work, and age. And these are responsible for health inequities, which are unfair and avoidable differences in health seen within and between countries.
So why should we care about the social determinants of health? Well, if you look at preventable contributions to death in the United States, you can see that medical care only really accounts for about 10% of it, and social, environmental, and behavioral account for much more, and things we really can't change at the moment are our genetics. So the medical care we provide, unfortunately, isn't the only influence on the health of people within a given community. So here, in this little 10%, is what we in medicine usually provide. But if you look over here, the social, environmental, and behavioral, this is where we really need to do more work. So this is looking at downstream, midstream, and upstream efforts. So downstream is where we function. It's where you're treating disease, treating injuries, trying to work on preventing and expanding the life expectancy. But if you look at midstream efforts, those are things where you can function in changes in housing, land use, transportation, working on nutrition, working on violence. And then if you look even more upstream, you're looking at things that you can do on a more national level or a more state level, and also addressing social inequities. Think about the Black Lives Movement right now. And so this, obviously, the upstream and midstream is where we need to do more, because this is where we're having trouble. This is things we can't do from our exam room.
So how can some of these upstream areas affect your health and or the health of those around you? Let's take a look.
So let's choose a couple of categories: land use and transportation and behaviors. So how do you think these upstream issues might affect your health or of the others in your community? And are these things that we healthcare professionals can fix in our exam rooms?
So guys, feel free to answer the one about how do you think these upstream issues might affect your health or that of others in your community. We want this to be interactive.
I believe that the way this can affect our health is not just through the physical aspects, but like the mental aspect as well, of how we feel about ourselves, how we perceive ourselves with our socioeconomic status, and with the statuses of others. And we kind of see that inequality between us and them, and that can play into our mental health and even our physical health if it becomes a poverty issue.
Yeah, definitely. Anybody else have any comments?
So our first example is about this case. It was a 16-year-old boy who was struck by a train and was sent to the ED. This case bothered me more than any case because of how tragic it was.
And this is a doctor who wrote this, by the way.
So this boy was not viable when he came in. He was dead. There was nothing I could do for him. My fear was that when they brought him in, I was going to see my son because my oldest boy was 15 years old. The boy they brought was a very big young man, so he didn't look like my son. The resuscitation was unsuccessful. There was a number of teenagers who saw this kid get hit by the train. They came in with the grief response of acute psychiatric pain. They were just screaming, dispersing, screaming. It took almost 2 hours for mom to get to the ER. She went to the wrong hospital. and breaking the news to my mom was absolutely horrible. It was a horrible experience. I will never forget the pain she experienced. This case haunts me. I have scars from this one. I went to this 16-year-old's wake to find a degree of peace. I did have to go through a debriefing with the nurse who was on because she was just as damaged from the case as I was.
So you were talking about mental health a minute ago. This, it's not just mental health from your living. Anything that you see out in the community news like this can also affect you.
So here we have a second case. In 2006, a 14-year-old Kristen Bowen was killed on the train tracks near her Chicago suburb of Villa Park. She was using a well-worn shortcut across the tracks that cut her residential neighborhood off from the school and the park they used. 4 years after Kristen's death, her twin sister committed suicide by stepping in front of a train near where Kristen was struck. The tracks are covered with balloons, memorials, and crosses commemorating those who have died. What do these cases have to do with land use and planning? Do you think that this is more likely to happen in urban areas or rural areas? And is this more, oh, sorry.
I'm sorry, I thought you were asking the question.
Yeah.
I believe it's mostly rural areas, or actually kind of both, because it honestly depends on, I feel like it goes into the land, funding, because if there's inequitable funding, or if there's not enough funding, there isn't precautionary measures for gates to be put up where the train tracks are, or warning signs, or speed bumps and stop signs. That's my opinion.
Yeah, and if you actually,
Oh, sorry. I was just gonna say, based off my experience with using train tracks as a shortcut, I can't see this as a part of land use and planning. Is that sometimes some areas, I'm not going to say all areas because different places have their own structures and routes, but I do believe that this would happen more likely in poorer parts of town than wealthier parts of towns. It's because there's not the convenience of different routes for the poorer parts of town. Let's say in downtown Fresno, towards the outskirts of it, there's not really that much different routes to schools. There's more of just a straight path, and so sometimes students, as basically what I've experienced, would use places like train tracks or private property to kind of maneuver their way as shortcuts to go to school and to kind of just move about through their area. And I believe it is a major case in poorer parts of town rather than wealthier parts of town. It's because of the convenience and the lack of transportation through where they're at.
And you guys are hitting the nail on the head. So interestingly, obviously it's a serious danger, but railroads have mainly made it a case where they're saying when a pedestrian is hit on the railroad tracks, it's a case of either careless trespassing or suicide. And so while they've attempted to enforce the notion no pedestrian should be found near railroad tracks, they forget to take into account the issues that you guys have mentioned and that not everybody owns a car. So think about it this way though. Say you have a neighbor and they have an unfenced pool on their property and your child wanders into it and they die. Obviously the potential for them to drown is quite high. And so that's with pools. And if you think about it, with trains, it's the same thing. You have industrial and urban neighborhoods, you have trains, often the train tracks are a shortcut, like you said, between where you are and where you want to be, or it may be a place where kids hang out because it's out of the way of prying eyes. And so what railroad policies fail to take into consideration is the poor, the people who can't afford to have transportation, the young who can't drive a vehicle, the elderly, the disabled. And so if your neighbor left their pool unfenced and the child died, then your neighbor could be charged with manslaughter, right? But if this happens with a train, then it's usually portrayed as the victim's fault. And again, is this something that we as physicians can solve, or is this needs to be something that is done at a community level? I can tell you from my part, I would have no idea how to do anything like this in my exam room. This is where we need to partner with people.
So now let's move over to behaviors. How can food security, insecurity, and hunger affect your behavior? And how can this affect your health and your life?
Any thoughts, anybody?
Hunger. You know, this is all based off my experience. I haven't actually been on the field to see how other people have reacted, but based off of like what I've experienced with hunger and how it affected my life was that you kind of just ignore the fact that you are hungry and you kind of just do what you can with what you have. And so you kind of ignore the fact that you are hungry. It's kind of, you don't really think about it because you are a part of it, that it's like a normal day thing. And so that's why I believe is the major thing is that people, it becomes normalized to be hungry, which it shouldn't be for you to be hungry or feel insecure about having little food or resources for yourself.
Right. And thinking of this question, can you as a healthcare professional or future healthcare professional solve the problem of food insecurity in your exam room? Probably not, right? So Teen Girl said that some young people in their community view incarceration as a viable strategy to fend off hunger. In Portland, a girl told us that a lot of people are choosing to be in jail rather than be on the street. It might not be the best food, might not be the best place to be, but it's a roof over your head, and every single day they eat breakfast, lunch, and dinner. Girls in Greensboro agreed. Jail is a luxury, especially for people who live in a trailer. Some people, including teens, will commit a crime to get a place to stay for a meal.
Okay. From a boy in rural North Carolina. By the end of the month, you can tell by how the kids act. The kids might be aggravated. You can tell they're depressed. You just know. It's hard to explain. You notice them going to the store a lot and at the beginning of the month, but at the end of the month, they get mad when you bring up food. From a teen in Oregon, breakfast really isn't. I'd rather save my food because I can't sleep when I'm hungry.
And what about human trafficking crimes and violence? These are other types of behavior. Believe it or not, human trafficking happens in Fresno. But don't rely on your doctor to recognize it. Why? We haven't been trained in it. There's actually a fair number of studies that show that doctors, nurses, other health professionals miss human trafficking just because it's not something that we were trained on.
So you might ask, how can this happen? A 14-year-old girl named Mia was excited when she started dating a boy who told her he was 19. She's always been insecure, and being able to talk to her friends at school about this cute older boy she met at the movie theater made her feel special. He showered her with attention and gifts, and for the first few months, everything seemed perfect. Then he started to ask her to send him nude pictures. She said no, but kept asking, sometimes jokingly and sometimes telling her that if she really loved him, she would trust him and send him the pictures. Eventually, she did.
What happened next was tragic. The young man, who in reality was much older than 19, sexually extorted Mia. He told her if she didn't have sex with him, he would show her pictures to her parents and everyone at school. Then he told her she needed to leave, or she needed to have sex with his friends and eventually with strangers. Mia was sexually trafficked for 3 months by this man, even while she went to school and slept in her own bed. But repeatedly her body was being sold for his profit. What started as pornographic photos of an underage girl led to sexual extortion and trafficking.
So when you look at health from this angle, it seems obvious our health is dependent upon a lot of factors that are really out of our control. So if you don't agree, think of what's been happening just this last year. We have COVID. We have the COVID 14, 15, 30. A lot of my patients have gained weight. We're all wearing masks. We're being quarantined. You guys are doing this instead of being in a big room with a bunch of us. We've had the fires. And did you know that even in Sun Valley, the horses are wearing masks? And to make matters worse, healthcare professionals I mean, healthcare, unfortunately, really has a blind side. There was a Robert Wood Johnson survey of 1,000 primary care providers, and it showed that although 85% of primary care physicians felt that unmet social needs would directly lead to worse health, only about 1/5 of these physicians felt confident in their ability to address their patients' unmet social needs. So it should be obvious to you that we can't do it alone. Instead, we need to partner with the members of our community. So if you look at all these different members on the left, and obviously this is not all inclusive, but where we have chosen to focus, because I'm a pediatrician after all, is on the schools and the universities. So what are the benefits of creating partnerships between physicians and the local community? Together we can create something called a local culture of health, which is a concept that's been pushed by the Robert Wood Johnson Foundation. And it's a place where doing things such as passing better gun control laws, placing stricter control on opioids, raising minimum wage, providing better access to mental health services like we heard from somebody already today, can lead to actually health equity. And you may not be aware of this, but Fresno's already started to do so. There's something called the FCHIP, or the Fresno Community Health Improvement Partnership. And so far it has more than 400 people from a variety of agencies and individuals across Fresno County. But so far it's been pretty much just composed of adults and not youth and young adults. And so we really want to hear from you guys. You guys are our voices of our future. What are your ideas? What are your concerns? What do you feel is important? So that's part of the reason we're here today. As healthcare professionals, we want to partner with our future healthcare leaders in order to improve community health. And we want you to think of something in your community that impacts you, something you'd like to improve, something you care deeply about. It may not be something that somebody my age cares about. That's okay. What's really important is it matters to you. And it doesn't matter how simple or complicated it is. If it's complicated, you just start breaking down and trying to attack the low-hanging fruit. So if you really think about it, you don't have to wait until medical school, pharmacy school, nursing school, physical therapy school, or what other health profession you're thinking about to have your first patient. Instead, you can really look at your first patient as being your local community. It's a place where you can gather valuable skills that will help you once you become a medical professional. And I guarantee you, if you have those skills, I, for one, would be incredibly jealous, because these are all things I've had to acquire after I graduated fellowship. The idea of your first patient, I don't know if you guys are aware, but Fresno County Department of Public Health has a health officer, a chief health officer. They're a physician. They have an MD degree or a DO degree. They don't have patients in the exam room. Their patient is the local community, it's their local county. So at UCSF Fresno, we've already started partnering with high school and middle school students, as well as medical students and a few college students like Alyssa. And we've had some of our high school students now become college students like Keyara. How did we do so? We partnered with their schools. Why did we do so? Because every day youth in our city struggle with the following. So if our goal as a residency program in pediatrics is to improve the health of adolescents in our area, we figured that we needed to use an upstream approach. And we wanted to answer this question. How could we partner with adolescents in the community to try and improve adolescent health within our community? And so what we did is we chose to place our residents actually into the schools. We used a constructivist approach, and the theory is that people construct their own knowledge and understanding of the world through their own life experiences. And this is really relevant when you're working with adolescents and young adults and you're using a youth as partner approach. And the idea is that this is true for adult learning theory too, is that people are most motivated when the subject is relevant to them. So if you wanted to decrease the incidence of heart attacks in the city, you wouldn't be going to a bunch of teenagers, unless of course the heart attacks were caused by teens taking cocaine, which is actually a well-known cause of a heart attack in a kid. They work best when they have life experiences they use as a basis for learning, including making mistakes, okay? And they work best when they're actually part of the whole entire process, including not only the doing it, but being involved in planning and evaluating the results. But we also had to recognize that although we were working with teens, and they're not aliens from outer space like a lot of people think they are, most adults treat teens like this. They talk about them like they're not there, or they talk to them, but they don't listen to them. I'm assuming that sounds familiar to you guys. And what really teens need are mentors, adults who can part with them to help them become change agents for their community, people who can give them a future, people who can help them think beyond what's happening to them right now. So we became their mentors. Every week we went to their classroom and we helped them design and implement community health research action projects on issues that they cared about, not issues we cared about. It was issues that they identified that were important to them. And all this time we used a youth as partner approach in which we listened to them. They felt like they were an equal partner in this. And along the way, they called themselves Teen Warriors for Change, and they actually have a Twitter handle and they have an Instagram and Snapchat and stuff like that. So our journey, one of our students told me, "You give me hope for our future." So we began 8 years ago now. We had 2 pediatric faculty, I was one of them, a few pediatric residents, a high school teacher, and 1 high-risk minority high school class at Fresno High. It's subsequently grown. They started spending, putting in results of their community action research projects, regional and national meetings. They started presenting workshops and amplifying teen voices and building health equity. Alyssa was involved with this in Texas a couple of years ago. You can see here, this is actually, that's a TikTok video that some of our students were doing on human trafficking. We added in our San Joaquin Valley Prime Medical students to the classroom. We added more schools. We continued to add new community partners. We started adding college students, and our residents began to get funding for their own community projects. Keyara and her partner actually won an award and money, and or something that they submitted, and we received further grant funding. On the left here, these are a couple of our high school students presenting at the Society for Adolescent Health and National Medicine. They were doing a workshop on amplifying teen voices. And this last year, we actually had our very first Fresno County Youth Health Corps. It was a collaboration between our residency program, the Fresno County Office of Education, and the Fresno County Department of Public Health. We had 16 teams from 15 different schools. This is actually going to start again next month for our very second one. And you can see here, this is Alyssa's name badge from the AAMC meeting, which is the National Meeting for Medical Education that was in Texas. You can see here students presenting at the Society for Developmental Behavioral Pediatrics meeting in Anaheim. And this is the website that Keyara and our other student built for us for diabetes. And then you can see there's a variety of other things, including our students have been helping with Job Shadow Drive for Fresno Unified. And these are pictures of teens saying what they wanted to change. So from this, we've learned a few things. We've learned that participating in projects such as this, our high school students have become change agents, not only in their communities, but I can tell you they've been doing this regionally and nationally. You wouldn't believe the number of people who come up and just are amazed that our students are doing this. So increasing their self-efficacy, and they've been learning how to amplify their voices. Empowering high-risk minority youth to be champions of health and equity within their local communities can have obviously positive, lasting, long health outcomes, because a lot of our students, a lot of my patients too, are exposed to a variety of ACEs, adverse childhood experiences, that can affect not only their physical, mental, and social well-being, but also their career aspirations. And what we've really learned is that from inauspicious beginnings, we started out in one little tiny classroom in Fresno High, and we just started making little ripples, and these form larger ripples, and ultimately they become waves of change. I mean, think about it. We now have the Fresno County Office of Education and the Public Health Department and our UCSF Fresno. We've now developed the very first Fresno County Youth Health Corps. So before we go on to the mission possible part of our workshop, where we're going to break you up into small groups, I want you to hear about what Alyssa and Keyara have done and what they've learned during their experiences with us. So first, let's hear from Alyssa.
Yeah, so I joined Dr. Kinman and this project at the end of my freshman year as part of this HCOP summer internship that used to be offered. If you're at Fresno State, definitely check HCOP out. It's a health program that supports students pursuing a health career, and they do that by providing resources, opportunities, support, networking, all that. So it's a great program. But during that summer, I created a curriculum buffet for high school teachers to use as a reference when implementing health-related project-based learning. I also started a brief mentorship program with pre-health students in Roosevelt High School, which is a local high school in Fresno. And along the way, I got to work with medical students, residents, faculty, and interacted with patients directly. I also got a chance to shadow Dr. Kinman and a few other pediatric specialties during it. And it's one thing to hear or read stories, but it's also another to listen from the individual themselves, from the patients. And so throughout this project, I also presented at the AAMC meeting, which is that picture at the bottom right corner, with other physicians and med students. I presented a poster at the UCSF Health Disparity Symposium, and hopefully also at the Flexner conference this next spring. And I could probably write a whole book on the things I've learned, but I guess two of the more important, relevant things for this talk is developing a personal and working definition of what it means to be a physician. If you probably asked me 3, 4, 5 years ago why I want to be a physician, I'll probably say something like, oh, I like science, I like biology, I like to solve puzzles and people and whatnot. But now, throughout this experience, I've realized that you're just not becoming a physician. You're also becoming an advocate, a friend, a teacher, and all these things in the community. And I've literally sat next to Dr. Kinman fighting insurance companies on the phone about getting one of the kids insulin. And I've sat in the exam room watching a kid draw and talk about their diabetes monster. And so a lot of these is not just treating the illness, but also caring for your patient as a whole. And so that brings in to my next point, which is that we can all be serving our first patient now, which is your community. Yes, you need a medical license to treat, diagnose, all that fun stuff, but you don't need a degree at all to care about people and be an agent of change. I know many of us from disadvantaged backgrounds might feel kind of small and almost incapable of making any kinds of impact, but remember that you all have your own influence in your little communities. And one thing that's kind of helped me internalize this more is moving away from the statement, I want to be a physician, to I will be a physician. Because now I think about, oh, what kind of skills and perspectives do I want as a physician that I can work on now? And one example that I bring is tutoring. So I tutor at Fresno State, which many of you know is a minority serving institution where a lot of us are immigrants and first generation students. So when students come in for chemistry help, more often than not, it's actually not the chemistry itself. It's more of study skills or learning how to navigate these difficult classes when you're also a single mom of 3, the sole breadwinner of a family, or when you're pursuing college 10 to 20 years out from high school graduation. It's considering all of these hidden social factors that comes with the problem. And so similarly, health is just not about the body, it's about the individual as a whole and the world around you. And so I guess I'm trying to say is that start developing these skills now, engage with those around you, and serve your patient, your first patient, your community, and see where that takes you. And for me, this means coming back to the Valley and serving those with who needs us the most. Next slide. And so I'm going to backtrack a little and talk about the work I did. And so, like I said, I worked to develop a curriculum to help guide teachers when they're teaching about health to their students. And this is a snippet of, I guess, the thought process behind it, where we wanted to engage in a youth as partner approach. And so we really consider students' opinions and voices to be important. We wanted to ask them personally what they care and what they want to do, because they do what they care, right? And so, as you saw, this translated into several projects related to domestic violence, teen pregnancy, and substance abuse. And you kind of almost transform it and give students opportunities to even present at national conferences like I did. And so really taking a step back and allowing students to take the lead have been a big part of how this project has been so successful. And after seeing this, I decided I wanted to kind of stay, do more work with Dr. Kinman and start kind of like a mentoring project with students. And I started in a local high school where I and a few other college students would meet with high school students after school, which was kind of difficult considering the whole schedule mixed up. Yeah, and so we're trying to expand it, but for me, it's led to me here talking with you guys.
And I would say going places you never thought you would go. Yeah,
definitely never thought I would visit Texas.
And do you feel like people listened to you when you were presenting at these national meetings? You know,
yeah.
Physicians, especially a lot of them at the AAMC meeting, were really physicians who are really high in the medical education world.
Yeah, I was talking to physicians from New York who had big leadership roles, and they were interested in what I had to say and the role I had in my community. And it was a very interesting experience for me.
Real quick before we move on, we have a couple questions in the chat asking how are we, maybe we'll get to this, but how they can get involved in this program. So I don't know if you want to address that now or wait until the end, but just want to let you know.
Let's wait till the end because we actually have that at the end.
Okay.
So let's hear from Keyara.
Okay, so I had a different project with Dr. Kinman. So through the UCSF program that paired me with Dr. Kinman, what I ended up researching was using technology to provide innovative and additional ways to educate our patients and their families. And this all kind of comes from what Dr. Kinman said of if you do not know why you're doing something, you're less likely to do it. This is especially true for the children and adolescents with a chronic disease who require medication daily. So the problem was that imagine having to poke your finger several times a day and you have to take insulin every time you eat or take medicine 3 times per day every day. This is a lot and it kind of consumes your life. And as a child or teenager or even adult, could you do this every single day for the rest of your life? And the problem is when there's no immediate bad result, such as pain, Dr. Kinman used the analogy of a stove, like putting your hand on a stove, and you feel immediate pain, you lift it off. But with this, skipping your insulin or skipping your medication, you don't feel that immediate pain. So we needed to find other ways to convince our patients to do their medical care as prescribed. But how do we do this? So we use technology to adjunct our normal endocrine practice. So the first step was we had to do surveys and assess whether the patients wanted these websites and what they wanted in these websites. So we ended up with 4 surveys in total. We had 2 specifically for diabetes. One was in English and one was in Spanish, and then 2 for endocrine. And there was 1 for patients and there was 1 for parents and guardians. So our survey results showed that 77% of diabetes patients and their parents wanted these websites, and 64% of endocrine patients and parents were interested in these websites. And then from those surveys, we got what they wanted in these websites. So some topics that the families were interested in for diabetes were teenagers and diabetes, school issues and diabetes, what is diabetes and what are the different types of diabetes, coping with diabetes, latest news updates on diabetes, exercise and diabetes. And then from the endocrine survey, we found that people were interested in what is my endocrine condition and why do I have it? Latest news updates on my endocrine condition, how can my endocrine condition affect my future career, links to additional resources such as videos, blogs, and apps, coping with my endocrine condition, and teenagers and my endocrine condition. So the second part of the project was building these websites. So we used Google Sites just because it was really user-friendly and it was free. And we can link it with a bunch of different apps. So we used Google Forms for our surveys, Google Drive, obviously, and YouTube. And then we made sure all content was either free or Creative Commons licensed. And this is what our diabetes website homepage ended up looking like. So as you can see, like on the left side, we have all those tabs with information the patients and parents had said they were interested in our survey.
And by the way, they came up with the title. I didn't make that title up. It was Keyara and her partner.
Yeah, we try to make it as patient-friendly as possible. And then, so the third step was making videos and putting it up on our YouTube channel. So we ended up making a YouTube channel, and we had some fun videos and some more educational videos. So the fun videos were more to empower our diabetes patients and show them that they're not alone. So one of them that we did was drawing what we called a diabetes monster. So what this diabetes monster activity was we would give the patients a whiteboard and we'd have them draw what they thought their monster looked like. And these are a bunch of examples. And then we'd take a picture of them holding it up so we can de-identify them. And then we put this in a video. And then all these videos could be found on our YouTube page. So here you can see we have all the more educational videos for diabetes patients, like how to manage carb counting, and then the fun videos like the diabetes monster video. So summary and conclusion, we found that a majority of our patients and parents were actually really interested in the websites and videos, and they thought it would really help them to find easy information relevant to their needs. And then we used Google Sites to build the websites, and we started to create video content, and we actually made a game, but I don't think that was on the slides, but we made a diabetes game so the kids can play. And then the main conclusion was these sites can be built by high school students interested in health careers under the guidance of a physician and clinic staff, thus providing medical pipelines as well as patient education. So what did I learn in this process? I learned a lot. I learned a lot of endocrine physiology and medical terminology. I got to see kind of what happens in pediatric clinics and how they work, how the staff all kind of comes together to help a patient. I learned how to interact with patients as I surveyed them, and how to think like a patient and include information to be given in a way in which they can understand it, because the websites, as I said, needed to be patient friendly. And I improved my technology skills, typing, HTML, making a Google website, ebooks, iMovies, and etc.
Okay. So, and did you expect that you would get that abstract accepted at a medical conference on your work when you went into this?
Not at all. Not at all.
And how was it presenting it?
It was really scary at first, but then I distinctly remember before me and Vincent went up to give our presentation, you were like, just make sure you guys have fun. And that kind of stuck with me when I was presenting. And like after the first few minutes, it all kind of settled down. My nerves kind of went away, and it was a really unforgettable experience.
And I remember when you sent me the email that you sent me an email that says, is this a mistake? And it was, tell them about that.
Yeah, so me and Vincent got an email. Vincent is my partner who helped me with all this. We got an email from the conference that said we had won an award, and I thought it was a mistake because I was like, I don't know, I don't understand. Why would we get an award? Like, I didn't see how big this was. And then she emailed me back and she was like, no, you guys, you're Keyara Piri, right? And I was like, yeah. And she's like, yeah, your abstract won an award. So that was a cool experience.
Okay, so our plan now is what we want to do is we want to break you into small groups to get you thinking about projects you could do. What we've called this is Mission Possible. This is, we presented this at the AAMC National Meeting. We presented this a couple of other places. But, you know, everybody always says something's impossible. And we found that if you persevere, it really does become possible. So what we want to do is break you up in a small group. Each group is going to choose your own adventure. And so that's something that's going to be put in the chat room for you. Your mission, should you choose to accept it, is take your assignment and use it to create a partnership to improve community health. So we have two different things. We have one is build your own adventure. If you already have something you're really interested in, you know, like I heard from somebody that they thought hunger was normal growing up. People might be interested in human trafficking. Or you could take one of our top secret missions in which we've already given you some stuff to start off with and choose to do that. And then on the mission assignment, you actually have directions and you have other stuff to help you complete your mission. And then what I would love to do is at the end is have you guys come back and give us a couple of sentences about what you guys came up with. Oops. And this is for later, guys. So now somebody's going to help you guys get into breakout groups.
Yeah, so I did put the link in the chat, so you can click on that tiny URL and it will take you to the QR code so you could access the information. So go ahead and grab that link now so you can have it available for you. And then I will push you out into 2 breakout rooms and we will pop in and out, but make sure you turn your videos on and turn your mics on so you can have a really good interactive discussion about your mission. And so if you have any questions, you could leave your breakout room and come to the main room, or we're going to have our 2 college students in there to kind of help direct you through this as well. And so I will go ahead and send you to the rooms. When you get a question on your computer asking if you'd like to go to the breakout room, please just hit yes, and it will take you there. And just to let you know, the small group sessions are not recorded.
So the blues are the my high school student quotes. I believe the Youth Health Corps has provided me with an amalgam of resources, experiences not offered anywhere else in Fresno County. It gives me a sense of confidence and realness when I think about becoming a medical student. 2 of my resident comments. At first I was ambivalent about this project, but looking back, it was one of the most rewarding experiences seeing these girls grow. And I had another resident who told me, she was like, as she was watching her students do a presentation, she says, I feel like a proud parent. So from my viewpoint, wouldn't it be amazing if we could create more and more of these collaborations, not only within Fresno, but outside across the nation, to really have youth like you guys partner with the local community, with physicians and stuff to, number 1, increase underrepresented minorities in healthcare, but also really, more importantly, to increase the health of your local community, especially if we can create dedicated spaces for you guys to present. Because that's been the amazing thing out of this, is seeing our learners, our youth, actually at these national and regional meetings and presenting their work and people listening to them. So our final words of advice we would give you is listen. Just listen. Be direct. Don't beat around the bush. I mean, I'm very direct. Don't kind of try to tip around the subject. Think outside the box, think creative. This whole project has been an outside the box sort of project. And silence is your friend. So if you're talking with other people, wait for them to talk, listen, you know, you'll hear some of their words, especially with teens. So this is our shameless plug. I fully admit it's a totally shameless plug. We know what we're doing may not be for everybody, but if you find this interesting and you'd like to work with us as we try to create more ripples, give more kids a chance for the future, and give all of you guys a voice, these are our email addresses. I will tell you that Alyssa and Keyara are definitely going to be easier to get a hold of than me, because after all, I'm medical director of Peds Endo and I'm doing a whole bunch of other stuff and I may not respond right away. But just remember, this really is a work in progress. We're learning from this. So if something doesn't work, it's called the PDSA cycle: plan, do, study, act. And if it doesn't turn out like you want, you tweak it. Oh, this didn't work at all, or what if we did this instead? This has been our whole 8 years. At the end of the first year, we all met because we got funding. All the people across the United States who got funding, there were 10 groups of us, were like, oh my God, we're not going to get anywhere. This didn't work. And they said, you guys chose 6 to 8 year plans. We're not surprised at the end of 1 year you haven't gotten anywhere. At the end of 2 years, we were all like, oh my God, this is working. And now I'm sitting here 8 years later and just going, this is amazing. Okay. So do you guys have any questions for us in terms of wanting to join us. Again, we're starting our second Fresno County Youth Health Corps. I would love people who have, it would be really cool if we had people who graduated from a high school going back and working with that high school, or working with a different high school kids. But the whole point is to give you guys voice, to get you guys interested, and understand you don't have to wait until medical school or other professional school to start making a difference in your communities.
So how would we join this? Who would we inform that we would want to join?
Are you at a high school or are you at a college?
I'm currently.
Jasmine?
Yes,
Which, are you at high school or college?
I'm at a high school. I'm currently a
Which
senior.
one? Which one?
I'm currently a senior in high school.
Yeah, which school? Which school?
Central West.
Okay.
I'm
Central
actually
West.
going to the youth corps.
Good. You're going to be joining the Youth Health Corps?
Yes, and I'm a
Steve
returner.
Holdridge?
Yes,
Okay,
I'm a returner
good.
from last year also.
Good. So keep working with that. I think I saw, did you guys do the opioid project?
Yeah.
Was that yours? Yeah, that was really cool. So I would say start working more on, instead of just gathering information, now start working on creating an idea of how you want to do something with it. Okay? For all of you guys, email Alyssa, email Keyara. Tell us where you're interested in. Tell us where you went to high school if you're in college. Tell us, you know, so we can start connecting people. Again, this has just been a very much a connecting thing. And we're plugging in people. That's how Alyssa came to me. That's how Keyara came to me. They became part of HCOP and they came part of the biomedical internship group. But they actually did more. Okay. If you are at a high school, it would be great if you talk to your high school principal about, are they a member of the Fresno County Youth Health Corps? I know Central West is, I know Edison is, I know Design Sciences, University High is very interested. They're trying to get the stuff together so they can join. But we had 16 high schools from all over Fresno County this last year. And then for those of you in college, definitely email Alyssa and Keyara, because Alyssa, do you want to speak about what you're trying to do some more?
Yeah, so I was thinking that with COVID being forcing everyone online, that we could establish kind of like a mentorship program between college and high school, and that it'd be easier this time, considering that we don't have to travel. People tend to have more time on their hands now. And so idea is establishing connections between college students at Fresno State and high school students who are looking to pre-health programs and careers.
Or even college students in Fremont. If you live in Fremont.
Yeah, in Fremont.
We don't want to keep those, we don't want to cut the people who live in Fresno but go to college elsewhere. We don't want to cut them out.
Yeah, and I think that's why being virtual is an advantage right now.
Do you guys have any questions? What do you guys plan to do next?
I know it's really, I don't want to say it's common, but it's, I feel like it is common among students to show interest in something and then kind of get scared and back off because of them holding themselves back. But for me personally, I feel really empowered by, you know, all these amazing individuals. I would love to, like, you know, really continue this and, you know, pursue reaching out to my community and being there for my community and showing up for my community alongside, you know, first year students, Dr. Kinman, and all these amazing students from, you know, different areas, not just in the Central Valley, but, you know, in Fremont, like how Tammy was, right? Yeah.
And understand it's the power of you guys together that is doing this. As individuals, we don't get very far. But when you group up with people and you start working with people in community, you start working with people who have a little bit higher power than you. Like for the people at Design Science who were talking, my group, who I said, you know, your principal's very interested. She has power within Fresno City. You know, I have some power within Fresno County Department of Public Health and within Fresno Unified as well, just because of where I've come from and what we've created. But really understand things don't happen overnight. It takes some time. So don't get frustrated.
Well, thank you so much, Dr. Kinman and Alyssa and Keyara. We are going to close the session, and make sure you write down their email addresses. So if you have any further questions, you can reach out to them and connect with getting connected with the Youth Corps. And so the last session that's going to happen is over in the main webinar room, so where you've been for most of the weekend, and that will be the UCSF admissions talk. And so you can, it's mainly going to be Q&A, so you can take all your questions about admissions process over there. And so, and that begins at 3:15. And so got about 10 minutes to take a little break and then join us back in the main webinar room. But thank you all for joining us.
We hope you've enjoyed it.